Good morning, everyone. This is Dr. Priya from Bangalore. Welcome to the Sibamed Instagram live program. Today we would be discussing on anti-aging techniques in skin. We would be discussing the most important therapeutic strategies as well as the topical therapeutic pharmacological ingredients which are used in anti-aging purpose. Skin aging is a very complex biological process which is influenced by both endogenous intrinsic factors and exogenous or extrinsic factors. These intrinsic factors would be our genetics, our cellular metabolism, hormonal influence and metabolic processes. Whereas exogenous processes are chronic light exposure, pollution, radiation like infrared radiation, chemicals and toxin exposure. So purpose of skin anti-aging is to achieve a healthy aging. As it is an inevitable biological process, the total reversal of aging is not a goal, but a healthy aging wherein we preserve each layers of skin as well as we change the appearance of the layers of the whole appearance of the skin is a purpose of anti-aging. So aging is associated, the facial aging is commonly associated with gravity impact, muscle action, loss of volume, diminishing and redistribution of the fat and loss of bony skeletal support, which happens with the increasing chronological age. In extrinsic aging, which is mostly because of the sun exposure, we see a lot of wrinkle formation in the skin, we see thicker epidermis, we also see mottling of the skin and solar elastosis. Whereas in intrinsic aging, which is like a chronological or a natural aging process, overall the skin can be thinner and atrophy of the epidermis is noted. Here there is redistribution of the collagen and also a little denaturation of the collagen is appreciated. So it has been said that above 30 years we lose around 1% of the collagen per unit area. So this usually exaggerates after the age of 30. Overall, extrinsic aging is characterized by loss of collagen 7. Whereas in intrinsic aging, we may have an alteration of our collagen 3 to our collagen 1 levels. Collagen 1 level can diminish faster than the collagen 3. So all the anti-aging research is directed towards 3 important dermal matrix molecules. Many of us know they are very popular molecules. What are they? They are hyaluronic acid, collagen and glycosaminoglycan. Hyaluronic acid, usually the dermal hyaluronic acid doesn't diminish as much with the aging compared to the epidermal hyaluronic acid. So this is a water holding molecule. So whenever there is a loss of epidermal hyaluronic acid, there is dryness, dehydration, water holding capacity diminishes, transepidermal water loss can increase. Collagen acts as a moisturizing molecule again. Collagen network is mostly in the dermal layers. Collagen is classified as a humectant moisturizer, like which draws the water from the lower epidermis to the dermal layer, and also the collagen decreases the loss of transepidermal water losses, it decreases. Also it can catch the moisture from the external environment into the skin layers. As I already told, glycosaminoglycan is a dermal skin matrix. It helps in binding the water molecule in the skin. So most of the anti-aging wrinkle creams to the filling agents to the invasive procedures or the lasers, all are targeting these 3 primary dermal molecules. So anti-aging of a skin is a very continuous process. It is not an instant thing. It is a very step-by-step process. It contains of biostimulation, rejuvenation and restoration of our each skin layer, which is achieved through a healthy lifestyle, emotional and stress management, through a healthy diet. There is something called a calorie restricted diet, which is known to increase the aging and known to prevent the aging and longevity. It is still under research. and also using the correct pharmacological products and the proper skin tools. So let us discuss a little bit about skin anti-aging approaches. So the first and foremost would be the routine skincare, wherein it is like a basic thing to do in the beginning of the anti-aging process. So it can be almost termed as a preventive management, wherein a skin barrier, our skin barrier is a very important thing which prevents the skin from dehydrating, and it gives a barrier against reactive oxygen species, barrier against pollution, barrier against microorganisms. So we need to preserve this. This also helps to prevent the collagen and elastin degradation over the time. So this is achieved with the simple skincare routine of using a good moisturizer, fortified moisturizers like with hyaluronic acid or with collagen, but penetration of these collagen or hyaluronic acid molecules deeper into the dermis is still not fully achieved. Next comes the photoprotection through the topical sunscreen, like a decent sunscreen with SPF 30 with a good PA, the NBUV, NBUVA protection with a water resistant capacity should be good enough. Systemic antioxidant molecules like vitamin C, vitamin E, carotenoids, copper and selenium, they also have a capacity to give systemic photoprotection, which is an important preventive tool in skin anti-aging. We have various endogenous molecules as well, means our body itself produces quite a few molecules which help us to have a good photoprotection, like glutathione, albumin in our body, vitamins in our body, phenols and superoxide dismutase, catalase, this kind of enzymes, they help us to have a good photoprotection. So overall these molecules are getting upgraded with a good nutrition. So nutrition fortified with probiotics, zinc, a nutrition with all antioxidant, a diet with good antioxidants, and also a diet with a collagen is gonna help us in long way to upgrade these inner protections. So next we shall discuss about a few topical pharmacological agents. The mainstay of today's talk was topical therapeutic anti-aging agents. So we can classify them again as antioxidants and regulators of cell turnover. So again, topical antioxidants help to preserve the collagen. They reduce the collagen degradation, and they reduce the free radical or reactive oxygen species damage in the skin layers. Whereas the cell turnover regulators, they help to improve the collagen metabolism itself, and they help to achieve better production of collagen in the dermal layers. The first category, which is antioxidants, it can be classified into again vitamins, polyphenols and flavonoids. So the vitamins or the antioxidant vitamins are vitamin C, niacinamide or vitamin B3 and vitamin E. These are small by their molecular structure, so they can penetrate the skin pretty well. Vitamin C is such a widely used, well-known ingredient. Vitamin C in a concentration of 5 to 15%, which is a heat labile L-ascorbic acid, what we call, can be a very good skin antioxidant which lightens the skin as well as improves the collagen, reduces the collagen degradation and improves the strength of the skin. Niacinamide, again a very popular, it's almost an OTC product now, which is used in up to 5% concentration, helps as anti-inflammatory, anti-proliferative as well as lightening properties. It does have lightening properties. Vitamin E, also called as alpha tocopherol, which is like one of the, it is used in the concentration of 2 to 20%, very widely in many of the skincare routine products, starting from the regular moisturizers to the fortified anti-aging products, which improves the hydration. Again, it is an anti-proliferative, anti-reactive oxygen species kind of ingredient. It is very good for dry skin with aging. So when it comes to the second and third, like polyphenols and flavonoids, these can be derived from green tea or soy extract. Soy isoflavones are known to have a very good lightening as well as photoprotection and DNA damage curbing capacities. So next group of agents are cell turnover regulators. So most of the curiosity and the research lies around these molecules. They can be classified as the retinol and the polypeptides and growth factors come under this category. So retinoid being a gold standard molecule for anti-aging, this molecule usually has a capacity to change the collagen metabolism. Its action usually lies around epidermal keratinocyte. It means it acts on the uppermost layer of our skin. It also has the capacity to change our dermal we have something called fibroblast in our skin. It can change our epidermal keratinocytes. So this is one of the favorite molecule amongst the anti-aging array. So retinoids can be again many types, like retinols. We have retinol esters, we have retinaldehyde. Basically all these three retinols are gonna finally get into enzymatically getting activated into trans-retinoic acid in our skin layers. So this trans-retinoic acid is the most powerful anti-aging molecule. So the prescription tretinoin is also FDA approved. Many people have a curiosity, why can't I use the tretinoin, the readily available retinoic acid, tretinoin. Of course it is FDA approved for anti-aging, but only issue would be that it is a very basically an irritant. So a drier skin type may not tolerate it that well. So the newer retinols, the commonest used retinol product is retinol, which can be used in the concentration of 0.1 to 0.05% as an anti-aging agent. And it can be combined with other anti-aging molecules like hyaluronic acid or vitamin C, because basically these can provide little hydration to the skin, and it can be easily used in conjunction with these other molecules as well. So next we shall discuss about peptides. Again, peptides are the newer molecules. Peptides can be, they are called as biomimetic peptides. Why they are called as biomimetic peptides? Because peptides have the capacity to signal the further production of collagen in the deeper layers of the skin. So we classify peptides are nothing but short chain amino acids. Less than 20 amino acid units is what they have. They can be classified as signal peptides. The commonest example would be palmitoyl pentapeptide, which is one of the very newer moisturizing peptide. So they also classified as carrier peptides and enzymatic inhibitor peptides. Carrier peptides are the one which carry the copper ions and magnesium ions into the skin. They can help against microorganisms. They can help in not only in anti-aging but in rosacea kind of skin as well. They help in hair health also, these peptides. So they are basically, as I told you, short chain amino acids. So if someone is looking for an OTC product with peptide, they have to look for two important skin peptides like tetrapeptides or hexapeptides. As the name suggests, tetrapeptides are made up of 4 amino acid chains and hexa are with 6 amino acid chains. So hexapeptides help you in brightness, whereas tetrapeptides will help you in firmness and elasticity of the skin. So most of these peptides and growth factors are also there as a cell turnover regulators. These growth factors are usually derived from plant stem cells. So stem cells also are a newer tool in improving the skin aging signs. So when we talk about hyaluronic acid, the degradation of the dermal hyaluronic acid is pretty slower whenever there is aging, whereas the epidermal hyaluronic acid is changing a lot with the passing on age. So most of the skin creams are helpful to replenish this epidermal layers of hyaluronic acid, because the dermal penetration of all these larger molecules is still questionable. But whereas dermal penetration of smaller molecules like vitamin C, vitamin E, niacin, these are all proven. So they may be reaching to the deeper layers. So these were the common therapeutic agents. Probiotics are also used in skin anti-aging nowadays. Probiotics, they also help in skin anti-aging. Next come tools in anti-aging is invasive procedures. The common invasive procedures would be chemical peels. Chemical peels will help in faster skin turnover. Then they can help in dense rearrangement of our collagen fibers by increasing collagen 1 levels or increasing the elasticity of the skin and wrinkle reduction. Visible light devices or the lasers or the IPL machines or the radio frequency skin rejuvenation is also a known tool. Even light emitting diodes are known to help in photoaging and all. Non-ablative lasers have very short, less risk profile and short downtime, and they can be improving the denaturation of the dermal collagen, and they do denature the dermal collagen and then help in reactive resynthesis of the collagen. Monopolar radiofrequency is a non-invasive way to get the skin tightening. It causes immediate collagen contraction, so one can instantly appreciate the skin tightening. It generates heat through the resistance which it creates in the dermis and the subcutaneous fat, and it also stimulates that reactive collagen resynthesis. Injectable fillers, PRP, Botox, these are also known to improve the appearance of the skin in aging. Hormone replacement therapy, which sometimes in aging, menopausal or andropause kind of issues, we can supplement the skin with the estrogen creams or oral hormone replacement therapies. The simple zinc-rich, astaxanthin-rich diet or collagen-rich diet or vitamin B3, vitamin C, glutathione-rich diet can help achieve anti-aging to a good extent. So the preventive dermatology, aesthetic dermatology is targeting the healthy anti-aging process. These are the common tools which I wanted to discuss with you all. Hope it was helpful.